I just want to thank Professor Ryan for joining us from Manchester today, and is a professor of social care and the author of Justice for Laughing Boy, Connor Sparrowhawk, A Death by Indifference. I'll let Sarah further introduce herself.
Thank you, and thank you very much for inviting me. So I just wanted to spend the next 35 minutes or so sort of talking about being a learning disabled person in the UK, being a person with learning disabilities, I should say. And the title of my talk is How Much Disability Awareness is Needed Before Things Change. So I don't know how many of you are familiar with the experience of being a person with learning disabilities in the UK, or have a family member who may have learning disabilities. But I just thought I'd provide a little bit of background to the situation. And just going back to this first picture, this is a photograph of a self-advocacy group in Oxfordshire that I've worked with for about 10 years now, My Life, My Choice, and this was at their AGM. And this group, if you Google them and see what sort of work they do, they're a very small organisation, and they do some extraordinary work in terms of campaigning on behalf of the rights of people with learning disabilities and advocating for them. And to the extent that they've been so successful that they've been started to donate money to other initiatives or organisations, which is quite extraordinary. Not many charities actually donate to other causes. So I just wanted to start off with a picture of this group. And I should actually own up that I'm their patron as well. I'm their first patron. And I beat Tom York and Alexandra Armstrong. Took them about a process of about 9 months to select their first patron. And I think it's my proudest moment that I actually pipped it to the post without even knowing this selection process was going on. So this is a great bunch and doing brilliant work. So we go back to 2001, and just this century, really, isn't it? There's so much history here, which is fascinating and grotesque at the same time. And if you read Simon Jarrett's book, I can't remember what it's called. It's got idiots in the title, so Let There Be Idiots or something. It's a fascinating exploration of going back a few centuries to show that before, people with learning disabilities were valued and recognised members of the community as people, and there was an awful lot of collective support. If somebody, for example, was accused of a crime and they had a learning disability, then people from the community would turn up in court and say that they were with them, so they couldn't have done it, or the judge would just be extra lenient. So there was an unsaid sense of collectiveness, humanness, and support. But if we fast forward to this century, in 2001, when there's two of our children there's little Tom, tiny Tom, and then there's Connor, who he's hugging. Connor was 6, 7 when Valuing People came out, and I was just there thinking, well, this is great. We're on the cusp of change here. This is a moment. Good timing to be a person with a learning disability, or to have a child with a learning disability, because Valuing People came up with this spot on stuff that should never be said, but had to be said, that it's all about people with learning disabilities are people first. We're all human. People should be treated with the same respect, the same dignity, should have the same aspirations, the same rights. And Valuing People was this new strategy that was really positive and really exciting, I suppose. Next slide, and then the next slide. Oh, so you haven't seen this. So Valuing People, a new strategy for learning disability with Connor and Tom, stating the bleeding obvious in 2001. Shouldn't need saying, but it did need saying then. And then the next slide, which is where we were at, is moving on to Valuing People now. A sense of urgency to underpin some of what was laid out in Valuing People 7 years earlier. Nothing's changed. So they have a strategy to make that vision a reality. And then in that photo there is Rosie, our oldest daughter, and Connor, who is growing alongside these policy documents, government initiatives, whatever, without any change happening. That was on holiday in Instow in Devon. Next slide, please. Just jumping ahead, I could have picked any number of initiatives, jargon-drenched things like transforming care, or all sorts of initiatives around improving the lives of people with learning disabilities. But here we have ADAS, the adult Adult Director of Social Services organisation and the Local Government Association have produced a framework for supporting adults with learning disabilities to have better lives in 2019. And the aim of this framework is to support and value adults with a learning disability and autism and their family and carers to live safe, well and fulfilled lives in the community. So you can see we have a period of 20 years with these initiatives, these policies, these documents, underpinned by terrible events that we know about, like Winterbourne View, massive events, and are underpinned by things we will never know about that have gone on. So what we know about is the icing, the absolute tip of an iceberg in terms of what lives people are leading in this country. And there's Connor there on holiday in Herefordshire, holding his iPod, walking up the hill about 200 yards behind us, which he loved, just walking along with his iPad, living his best life. Okay, next slide, please. So I just wanted to dip into, I'm a sociologist by background, and I've always really liked this C. Wright Mills book, Sociological Imagination, written in the 50s. C. Wright Mills distinguishes between personal troubles, which are related to an individual's character, and those limited areas of social life which is directly and personally aware or has a say over, and those limited areas of life that we have agency over. They are limited areas of life. Most of our lives are very much impacted on where we're born, who our parents are, the situation we're in, all sorts of different factors, whether or not you're disabled, what your sexuality is, all the different sort of demographic characteristics will impact on the life you lead in different ways. But C. Wright Mills here is talking about personal troubles, those things that are directly they are coming out of you. These are things that you do yourself. Very difficult once you start to think about this, what these are. And then on the next slide, and then so he's distinguishing between personal troubles and public issues. And an issue is a public matter that affects us all, and it's a matter that we should all care about as citizens of the same society. These are important issues. These are issues that we all need to address. They're public issues. And a lot of the trouble that happens in all sorts of areas of life for all sorts of marginalised people is they're seen as personal troubles and not public issues. But for people with learning disabilities, and I'm only talking about people with learning disabilities here, and you can obviously pick on other groups of people who are marginalised, which is the same, but I think there is something slightly different for people with learning disabilities because they have become public issues. We have had the Winterbourne scandal. We have had a series of events that have happened that there is so much evidence. We don't need any more evidence. We know that certain people, because of a label they have, lead lives that are impoverished, and it's not a public issue. And that layer of public issue is within, say, the organisation of NHS England, is within the government. Everybody knows, we know that people are leading impoverished lives, and yet it's not a public issue still. So what is going on here? And that's the question I hope you lot are going to help answer not answer because I don't think it's answerable, but certainly have some suggestions around why this might be. Okay, thank you. So next slide is, sorry, you need to go back one. So I just to underpin this really, Neil Crowther, who is a consultant human rights expert, he writes a blog, and I just happened to read this for a different reason the other day and sort of thought, yeah, spot on. I believe that all people are born equal in dignity and rights, and disabled people are part of human diversity and humanity. Far too many people are devalued by society and frequently lack the support that would permit them to lead an equal life as an active member of their community. So why are we not able to all live together equal lives? What's stopping? What is going on here? I keep asking, what's actually going on here? So next slide, please. Just for a bit of context, because I don't know how many of you know and what you know about your knowledge about learning disabilities. People with learning disabilities continue to experience deep inequalities in comparison to their non-disabled peers. There are an estimated 1 million adults with learning disabilities in England who are disadvantaged in terms of relationships, health and employment. And if we just look at the employment for a second, less than 6% of the 1.1 million people with learning disabilities in the UK are employed. less than 6%, and of those less than 6%, I think it's 71% are employed part-time. So we have pretty much 1 million adults in the country who have not got a job, despite the numerous initiatives to support people into work. And there's no reason why people can't have a job. Some people can't have a job, but for a lot of people, there are jobs they could do, but they're not doing them. And this less than 6% has remained constant. And actually, I was looking at the NHS, that's part of the long-term plan. The NHS set up get people with learning disabilities into employment in the NHS in 2015. And they reported, I think it was last year, they updated how they'd done. And of their 4 or 5 million employees in the NHS, they have supported 270 people with learning disabilities a year in a form of internship. And I don't know if anybody's done any research around how many of those interns translate into actual jobs. But the people I know who have been on internships have thoroughly enjoyed the opportunity to be in a work environment, to contribute, to have peers, to be able to do all the things that work brings to us: money, pride, achievement, sense of purpose. The intern finishes and that's it, off you jog. And it's almost worse, because then people have an expectation that nobody's going to, that they have an expectation that is unlikely to be met. And so there's no point in putting these processes into place, these initiatives. Oh, let's do a set of internships, if you're not going to follow it up. There's such a level of short-termism and short-sightedness and ignorance that goes into these initiatives that are doomed to fail. Sorry, I seem really I feel like I'm Captain Bringdown talking about this stuff, but actually, when you start to think about what people's lives are like in a civilized society, it's totally unacceptable. And then the bottom fact there, this was in 2013, we found this out, women through the MenCap dying through, we had the MenCap dying early report, and then we had the confidential inquiry into the mortality rates for learning disabled people. That came out in 2013. Everybody was a little bit shocked. It actually made the national news that people with learning disabilities are dying between 28 and 20 years earlier than their peers, even if they're not ill. The label learning disability is not an illness. It's a label that denotes certain characteristics. And obviously, some people with learning disabilities, there is a higher percentage of certain long-term health conditions that are associated with people with that label, but these are not death sentences. These are long-term conditions that other people have. But for people with learning disabilities, they translate into early mortality. And again, this has remained consistent despite initiatives. So can we have the next slide, please? And then you add the pandemic into the mix, and there's a paper written recently around the deadly discourses which emerged through the pandemic around the do not resuscitate type stuff, around the allocation, the early conversations around, well, who deserves healthcare who deserves the healthcare treatment? If people, if we're going to be stretched for resources, who gets that treatment? These deadly discourses emerged publicly and visibly in a way that they've always operated not so visibly before. And by summer of 2021, there's a report here by, I think it's Jane Flynn, over a quarter of adults with learning disabilities across the UK we're not sure when or if their lives would ever go back to normal. There's a compounded impact of the pandemic on people with learning disabilities and other people who have sort of long-term conditions that are more susceptible to the disease. But for people with learning disabilities, they did not know when or if their lives would return to normal. So the pandemic has brought a further marginalisation for this group of people and exclusion, reinforcing systematic inequalities that disabled people face. Thank you. So just a brief personal detour. You've already seen some pictures of Connor and Tom and Rosie, and there's our 5 children at the bottom there: Owen, Rosie, Tom, William and Connor. Connor was diagnosed with learning disabilities when he was about 18 months old, mental retardation then probably, or something even worse, global developmental delay, autism, the whole lot. Here he is with his family, and he was just a member of our family, basically. But that label brings a whole set of stuff with it, which is very difficult to negotiate. And I'm sorry if people don't know what happened to Connor here, because this is quite distressing. Next slide, please. So just tangentially, because this is an important piece of the jigsaw and it shouldn't be, I started writing a blog in 2011 called My Daft Life, in which I was documenting bits of our home life because it was hilarious, because Connor was so quirky and funny and very unusual. He just had such a wonderful, unusual way of looking at the world, and he would question things in a way that, as a sociologist and anthropologist by background, was just like, he's like an unlikely ethnographer, because he would just be there saying why about things all the time, and you sort of like because, and you sort of like say why something was, and then it's sort of like it would just evaporate why it was, because your reason didn't actually stand up under that sort of scrutiny. So he added a dimension to our lives that was extraordinary, and I documented it on this blog, which was really funny for a year or so. So if we go to the next slide, there's an example of a post. So Connor was at a special school, and the form of communication was the school diary, where they just sort of say, oh, Connor did meal prep today or whatever, but no other detail, because they've got to write it for 10 children or whatever. And so when we were eating tea, I'd always say to Connor, how was meal prep today? And then this is the conversation around his fail kebab, which he tried to cook, but it went wrong because he didn't have a skewer, which I was probably supposed to give to him to take to school, I suspect. Now, looking back, the pennies dropped, so he didn't, I don't know if that's the case or not, but I wonder if it was. And so I asked him, what did you eat then if your kebab went wrong? And he said, bits. So it was this funny reflections on everyday life he used to say, and I just used to translate them to the blog and put that there. So if we go to the next slide. Connor, eventually, there's a book written about this, it's all online anyway, but when he turned 18, he became very unlike himself, very uncharacteristically aggressive, really difficult. I can't even describe it now. I still can make no sense of what happened to Connor from his 18th birthday, but the upshot was we had him admitted to a assessment and treatment centre, which happened to be about 2 miles from where we lived, which we'd never known existed before. And we were fed the line that it was a specialist centre with a staff of 20. There was 4 patients there. There's 5 patients. There would always be 4 members of staff on duty. There would be a speech and language therapist going in. There would be a lifestyle coach going in. There would be psychologists, psychotherapists. Every ist you can name would be there. And so at the time, when we were absolutely desperate, this seemed like a good thing to do. It turned out it was the worst thing we could have ever done. And the long and short of it is Connor spent 107 days in that space. He was section to section, all sorts of things went on. They changed his medication. He was very susceptible to medication change with his epilepsy, which was pretty much under control when he went into the unit. And after 107 days, he went to have a bath in the morning. We still don't really know what happened. And while 2 members of staff were doing a Tesco's online order in the office next to the bathroom, he drowned. So I can't say anything else about that because there's not much else to say about that. Because I was writing the blog, when Connor was in the unit, I started doing daily entries for the unit. It was day 1, day 6, not every day, but days, just reporting on what was happening and all the rest of it. It was just something, it was a form of doing something. It was a form of agency, I suppose. And so I documented different things that happened in the unit that weren't brilliant. And that was all there online, for anybody to read. And when Connor died that day, I put a one-liner on the blog to say that he died, because I felt like it was terrible. People didn't know. So I just said, Connor's died and the police are involved and he would be pleased about the police because he loved the police. And a barrister got in touch with us and said, I've been following the blog and I just wanted to let you know that you probably need to be aware that the NHS won't investigate this as they should do. So this threw up a whole other set of stuff which I can't talk about today because I'm very conscious of time, and was just shocking that the idea that the NHS wouldn't investigate somebody's death was just beyond it was incomprehensible. And then about 2 weeks later, in the middle of the night, I was reading the trusts, because it was an NHS trust. I was reading their board minutes, the things you do, parents of when children die, unexpected deaths. It's extraordinary what you do. And I found this sentence or this paragraph on about page 284 of the board minutes, public board minutes, that said that a user died of natural causes. All appropriate systems were in place. So completely reinforcing what we've been told the day after Connor died, or the day Connor died. Extraordinary actions by the NHS to announce this was all fine, nothing happened, nothing to see here. One of the early mortality, obviously, die early, that's that. So we go to the next slide. So then we sort of had the resources, because my partner and I are academics. We had sort of social networks on social media. Connor's, though the blog was anonymous at the time, it had quite a readership, and so Connor's death sort of had a bit of resonance around social media, because people have been following the blog, enjoying the sort of happy times. All of a sudden, this young man's dead in a hospital in Bath, and it's incomprehensible, and there's no coverage, nobody's saying anything. And so gradually, with just this consistent, open documenting of what was going on, challenging, people drew together, and we had a hashtag, and George Julian, the knowledge transfer consultant, was involved. She was a core person at the beginning, or throughout, she still is, bringing together this social movement against injustices that are inflicted on people with learning disabilities and other marginalised groups in this country on a daily basis. But for some reason, we managed to generate all sorts of stuff. So I'm just going to go quickly through some of the beauties of what we generated. So we have the next slide. JusticeforLB. So there's a flag at Glastonbury there with Connor's face on, with a hashtag JusticeforLB, made it to the BBC front page of their Glastonbury coverage. We go to the next slide. We came up with a manifesto. We arranged to meet. We tweeted the head of the NHS England chief exec, David Nicholson, at the time. Just tweet. That's what you can do on social media. It's democratising. You can just tweet people. Excuse me, Mr. Nicholson. Excuse me. This is going on. What we can do about it? He replied, said, well, let's meet. And so we went up on the train. And the night before, my partner said, we can't just go and say, this is what's happened. It's terrible. We need a plan. So we came up with a manifesto of what we were trying to achieve. It's online on the blog. Took 5 minutes. Well, we want to find out what happened. We want to make sure it doesn't happen again. And we want to make sure that the wider picture, that people's experiences are improved. I mean, it's very, very simple. Look, there's a few more words in it than that, but that was basically it. And we said to David Nicholson that we were absolutely devastated and revolted that the NHS Trust said that Connor died of natural causes. And they announced this, and everybody agreed. It's in the minutes. Everybody at that meeting agreed that oh yeah, this young 18-year-old man has died of natural causes. This to us was unfathomable. And David Nicholson said, well, I should commission a review into the Trust's deaths to see how they've investigated deaths over the last 5 years since they became an NHS trust. He retired about 2 days later. We came back on the bus thinking, well, that was kind of amazing, but he's off now, so he probably won't do that. It's very easy to just go. And he did actually do it. And I have a lot of respect for him doing the right thing, but the bar's quite low in this area, so I have a lot of respect for him for that. Next slide, please. So we started the campaign. We ran a sort of sub-campaign called 107 Days. A year later, starting on the day Connor went into the unit, and we asked people to adopt days and do anything they wanted, as long as it was positive, and they raised awareness around people with learning disabilities' lives, or they raised funding for us to have legal representation at Connor's inquest, because we had to pay for legal representation, even though the trust could draw on the public purse to arm themselves with, in the end, 7 barristers and 7 legal teams. And so we had to raise £25,000. So this is a flyer that was produced within 32 minutes on Twitter when we asked if anybody could produce a flyer for us. And the guy who produced it said, could you not make it public for a day? Because otherwise my rates will have to drop, because he would charge quite a lot to produce something like this. And actually it doesn't take long at all. So that was quite funny. So that's our flyer advertising the 107 days. Now, George and I thought we would just rehash old blog posts on these 107 days if necessary. Just to, day one, this is this funny blog from like whenever, but in actual fact, we adopted, every day was adopted, and by the end of it, we had 3 or 4 people or organisations adopting days. And I'll just give you a taste of these now if we move on to the next slide. So people started sending us in pictures of buses, because Connor loved buses. Children buses, you can't see there, but they're writing things like Connor or Connor Loves Buses, or Love Emily, age 9. All sorts of different buses. We have folders full of bus pictures, which is extraordinary. And if you pay attention to that bus on the top row that's actually got people in it, that was made from Tesco's cardboard boxes, and the family sat in the box and took a picture to send to us. So you can see this sort of really spontaneous outpouring of doing something, being able to contribute something, and it didn't matter what it was. So we go on to the next slide. We had fundraising events. The cakes at the top were a party where I worked, where they've actually got pictures of Connor on the front. We had a big party at the old mini outlet, company in Oxford. A massive party, and you got the LB balloons there because Connor was known as Laughing Boy. And then we're back to the Tesco's bus there, and the family in the bus in their back garden. And then we go to the next slide. We've got the flag at Glastonbury again. It went 2 years in a row. In that top picture, you've got Catherine Runswick-Cole, another academic at the left side, I think, for you watching. She's actually in New Zealand with the same flag, and the guy with the shirt and the tie is the New Zealand Disability Commissioner and a group of self-advocates. So this flag has gone from Glastonbury via Australia to New Zealand to the New Zealand Disability Commissioner. Extraordinary. And then the picture at the bottom there is a conference in Chicago. The American Sociological Association actually passed a motion to say that what happened to Connor was outrageous, and they agreed to have a session at the following conference, which was in Chicago, about what happened to Connor and other people who've been incarcerated in similar situations. And that's the panel, and it's Mark Sherry is the man there, second from the left or right, who arranged that conference panel, and we went out and gave a talk. So that's, again, another extraordinary reach of our campaign. And then the next slide. So the bus, I mean, hilariously, the cardboard bus, the Tesco's boxes, we actually took it on the Camino twice. And we walked, I think the second time we walked 325 kilometres along the Camino in Spain towards Santiago de Compostela. And we stopped and we chatted to people on the way, and Spanish people couldn't believe what had happened. We crowdsourced money for people from My Life, My Choice, the picture at the front, to come out and join us. And they came out. We raised the money in less than a day, I think, to get people passports, to pay for support workers to go the flights. And we all stayed in hostels. And this caused such a stir where we were in northern Spain that we ended up on the news. The news, local news came and interviewed Paul Scarrett, who you can see there outside one of the hostels, around what are you doing here and why are you doing it? Quite extraordinary, really. And then the next slide. Yeah, that's the end of the magic bit, I'm afraid. Sorry, I didn't put many on because I know I'm thinking about time. So if we just go back to that slide just before we get to this bit, which is just so depressing. The thing about the campaign was this campaign here, there's nobody leading it. There's no structure. There is no organisation at all. There is a hashtag. There's George, Julian and I being the admin people, responding to emails, sorting out the days. We would message each other and sort of say, oh my God, so-and-so's just booked a day to do this. There was 2 villages in Yorkshire got together and had a tea party. A brownie pack in New Zealand drew buses in their session and sent photos of that. We had tiny contributions and we had massive contributions. And the whole point of, which we didn't plan, we didn't know what we were doing at all, but everybody was welcome and any contribution was welcome. And it didn't matter what it was, just those rules, positive, awareness raising or fundraising. And we raised the £25,000, which is great. So that's the lovely fun bit. And it means the world to me still, because Connor Love Buses, so much of our campaign that continues relates to everything Connor loved. He wanted a heavy haulage company, and he's got his name on a heavy haulage lorry in Marlborough. He's got his name on 3 red double-decker buses in Northampton, and he now has a bomb disposal unit named after him, Connor's Rig. And these things were just his absolute dream. So going back to the next slide then. So David Nicholson commissioned the review. And he commissioned an organisation called the Mazars Review, which is a global consultancy. And they did this review, And it's a fascinating, I mean, somebody should write just about this review in a way, because the story behind it is extraordinary. So you've got this independent, and that's the key. This was an independent organisation. It's not an independent organisation that the NHS always uses over and over again, or the police or the army or whoever. This was an independent organisation who did this review. And so they went back 5 years to look at the deaths in the trust and the responses to deaths that were unexpected. And the findings are extraordinary. And they found that this is just one finding, but it's relevant for today, really, that there was 327 deaths. Sorry, it still upsets me, this. 327 people died with a learning disability in that time, and there were 2 investigations. One was Connors and one was another young man called Edward Harvey. And this upsets me so much, because I just think that was one trust that this scrutiny was put on. And you can't even begin to imagine how many other people have died at any age. And the consultants or whoever and the coroner have all colluded to say, yeah, natural causes. Broken neck, natural causes. Constipation, natural causes. Scabies, natural causes. Just extraordinary findings of this report. Of course, it caused such a commotion. It was, the trust sat on it, NHS England sat on it for months. It was leaked to the BBC by some cheeky scamps, and Michael Buchanan of the BBC had the integrity to not publish the report until the people who leaked it said, okay, the NHS England are never going to release this report. And it came out on December the 10th, I think it was, possibly the 15th. December the 10th in 2015, and it made national news headlines. Jeremy Hunt was there, cross-party condemnation for what happened, what this report was showing, and all sorts of stuff was promised. When you read Hansard again, you can see Jeremy Hunt said absolutely nothing in response, just, oh, it's so outrageous, it's so outrageous. I agree, it's outrageous. He did not really say anything of substance, whereas everybody around was saying really important points about this report. And in fact, they went on to do a learning from deaths program, which went on to a learning from blur program, which went on to this, which went on to that, which went on to nothing, absolutely nothing. And the learning disability focus was lost in the first iteration, which again is scandalous. Why is that? This came about because of the deaths of people with learning disabilities. In fact, the only learning that came out of this report benefited people who were probably going to be all right anyway. And the deaths stay the same. So this is a really shameful part of what happened. And there's a lot more behind that report to be told as well, but not now. Okay, next slide, please. Just a little wrap up of what happened then. So eventually the inquest, we had the 2-week inquest. They found negligence, of course. I mean, we all know this. We knew this on the day Connor died. And then the health and safety executive kicked in after a battering from Norman Lamb, an absolute battering where he almost took one of the guys by the throat to say, why aren't you doing this? And eventually in 2018, and this was the tweet I did the night before the judgment, the trust had already pleaded guilty at this point to a criminal charge. 10 hours till the judgment, half a decade, 5 years, 107 days, a lifetime. And you can see that Tesco's bus is outside the court, the criminal court in Oxford. Still, my dad had sort of repaired it over the time. He kept patching it up because he's a very hands-on repair person. There's my mum, my sister, and our children. Tom, little Tom there as a big Tom, and Rosie, Owen, and William, all outside the courtroom there. Okay, next slide. That was it, £2 million fine, the biggest fine in the history of the NHS. And we were told that we were told by the HSE, who absolutely handled the whole thing beautifully, exemplary case of how to do something, which I'm sure they do over and over again. They said the fine will be small, you need to accept that. They really managed our expectations. It's an NHS trust. You have to really understand that the amount of money doesn't reflect Connor's life or death in any way at all. And TJ Colvin, who was the second patient whose death, if that had been investigated properly, Connor's wouldn't have happened, is the logical thing. Because if the trust had implemented changes when she died 2 years earlier, then Connor would not have been able to die, is the story. I'm not sure if that's true or not. So we're all in the courtroom. My Life, My Choice are there. Everybody's there. It was packed. the media box, the journalists is packed. There's Michael Buchanan's was there. People who'd followed all the way along the most decent journalistic coverage and integrity, just extraordinary. And the judge said started at 3 million. And I was just there, sort of thinking, well, he's going to roll back to £200,000. And he went back, he rolled back, take a bit off because you pleaded guilty, take a bit off because you've obviously made changes. And then he stopped at 2 million. And I sort of thought, fair play to you, because, these things need a sharp shock. And it was not going to affect the trust financially, as the judge made clear, for other reasons. And the judge also said, which I thought, again, the humanity and the joy and the integrity that we have experienced along the way, alongside the most awful experiences, is quite something. And the judge put in the judgment that's online, he sort of said, pay special tribute to the family who have endured an absolute drubbing from this trust, And I sort of thought that's great, because that's exactly as it has been, and this stuff needs saying. So, next slide. Okay, so this, to bring us up to date, because I'm going to finish now, I've got one slide left after this, is that we had that moment, we have that campaign, we had the Valuing People 20 years ago, Valuing People now, we've had all the stuff that's come in between, the Mazars review, everything. And this tweet is literally from this morning, where a school for children with learning disabilities, profoundly disabled children, has been closed, and the parents are taking the school to court. And when you read the coverage, which is only local news coverage because this stuff doesn't make national news that often, staff said the young person involved in these incidents of being abused and tortured is such a sweetheart, it's heartbreaking. And it's absolutely extraordinary that in this piece, both the private provider that was charging £300,000 a year to torture these children, and the staff are there sort of saying, oh, they shouldn't have shut it because we were really getting a bit better at what we were doing. We'd started improving. And yet they had 2 years of 30 allegations of abuse to investigate. The police, who didn't press charges because they never press charges because the victims cannot say. And so here we are, up to date right now. And so I think there might be one more slide, which is going to go over to you. How much learning disability awareness is needed before things change? And I'm asking you lot. So any questions or comments or thoughts?
Thank you for that extraordinary presentation, Sara, and thank you for sharing your story. I agree that many things need to change, and I don't understand why things haven't already. I'm going to check the Slido to see if other people have put in questions first. Ellen has asked, are funders and ethics committees too risk adverse in colluding on the exclusion of LD people from studies?
Oh, Helen, that is so spot on. I don't know if you saw the piece by, is it Carl Spall in the Lancet a year or two ago? They went through and reviewed the NIHR portfolio of studies, and they reviewed the exclusion criteria of something like 16,000 studies. And they found that learning disability was an excluding factor, just learning disability, 2 words, in something like 61% of the studies. And ethics committees would have approved that exclusion. And you can't exclude learning disability. What does that mean? You've got to speak to people. You need to know if people can take part, and people have a right to take part. And if people don't get the right to take part in research about issues that affect them, because the medical conditions they were looking at were things that were prevalent amongst people with learning disabilities, then the support and treatment is never going to change. And so ethics committees, they need to change, and that should be such an easy change. But I will say, on one of the projects we're doing at the moment, we did go in and be quite bombastic and sort of say we can't give one participant information sheet, because we got a participant information sheet in Easy Read, but people might need different versions, but we don't know till we ask them, and we don't know till we meet them, and so we might have to do an audio version, but we can't produce everything that we could possibly need for an ethics committee before we know what we need. And actually they did pass it, and it was one of the quickest committee meetings. The person who went with me said. So I think that that's an easy win there, is to get ethics committees to understand what they're doing when they just accept an exclusion based on 2 words.
Thank you. And I put the question up at the beginning because it's something that was on my mind. Although, obviously, by the end of your talk, as ever, there were other things on my mind. And I just wondered what you think the people from the Oxford group, or you as a family who've spent so much time on this, think could actually be fought for now as a quick win. I mean, so
yeah, I mean, what we could do for a quick win. Yeah, I think that we're not going to change things until people mingle more. I'm a big mingling fan because I think you just hang out with different people and learn different things and understand different people's different perspectives of the world. You pull yourself up so much because you sort of think, oh God, that was really embarrassing of me to not think that, not realise that. So I think the more people mix and hang out with each other, the better things will be. And I think certainly for medical and social care education, I would say that any medical student needs to spend time with, say, a group of people with learning disabilities, or they need to demonstrate that commitment before they even get into the university, quite honestly. But not in a horrible tick box way where they're just turning up and ticking the box, but in a way that they realise that these are people, that there is so much fun to be had by mixing and mingling with different people and rubbing off different experiences. So I'm not sure about a quick win there, and I think thinking of quick wins is a good idea because we could pick those off, couldn't we?
I have a question. In my research, I look at families who are living in temporary accommodation, especially children who are under the age of 5, and many children that the theme that has come up is that children with either learning disabilities or who are neurodiverse or even have physical disabilities are put into temporary accommodation that aren't conducive to their needs. So like someone who is in a wheelchair will be put on the 3rd floor, but there's no lift. And someone who is autistic will be put in a very cramped room and have no place to do any of their therapy. What do you think housing can do to help more of these communities in turn? Like for me, I just say they need to have better accountability for having policies to have suitable housing. I realize that there's a shortage of housing, but they need to actually make sure that there's safe and suitable housing for these children.
I mean, I think policies, are good, but schmolicies, quite honestly, sometimes when they're just not followed, are they? They've got nothing to underpin them. But I think with the housing thing, and it's funny, there was a meeting I didn't go to in Hull near the university here, where some autistic people had contacted their local councillor to talk about the housing and the inappropriate housing they were in, for all sorts of different reasons around sounds and lights and all sorts of things. And so we're hoping to get a small pot of funding to go with the autistic people around Hull, filming the bits that are the problem and explaining why. Because I think if people understand, there's a bit more of a chance. If you understand, well, I mean, why you wouldn't understand you shouldn't put a person in a wheelchair on a 3rd floor is sort of beyond me. There's a lot of illogical stuff going on here. But I do think if people understand what the problems are, it's slightly easier for them to not necessarily perpetuate those problems. So I think understanding is important. But I think what happens, and I think that the reason why our campaign was so successful in inverted commas was because we concentrated on the joy and the pleasure and the fun and the creativity. Because I think on the news you get these stories and it's harrowing to sort of see this child on the 3rd floor can't move, completely inappropriate housing, and it's all really it's presented in a way that people just glaze over just because it's painful, it's horrible, or you don't care, or you're just like, oh, they just deserve it, it's not going to bother them, they're not really a person. So I think there's something around the representation and you can't, and it's not us representing them in inverted commas, it's not an us and them, It's about understanding and the mixing. It comes back to mixing more of you mixed with people. You would sort of be like, and this is the Spanish. When we were in Spain, the culture is very different. They could not understand what we were saying, because in Spain the culture is so different that people are it's a very collective support going on there, and you wouldn't get to the stage where a child was on a third floor in a wheelchair, because everybody around would be saying, well, you can't do that. So yeah,
absolutely. I always just think people should just think, what is it like to be in someone else's shoes? And that's how at least I think about it, and that's what I tell other people to think about, just even from that perspective. Does anyone else have any questions? You can just jump in. Okay. What would you say is like the next step in terms of
good question. Well, I had some time allocated at work because I've had a lot of time off to go to all these, well, grief. I had grief time off and mental ill health and going to hearings and all the rest of it. And so I got I had 3 months full time to apply for bids across 6 months, and managed to get all 4 bids funded, which was a bit of a surprise. So I'm now doing over £3 million worth of research around learning disability in different areas, growing older, leading a flourishing life, and also giving evidence at witness to harm hearings, because that's something else I did and was very damaging. And these projects are all collaborative projects. We have employed people with learning disabilities. We employ family carers. We are doing this work it's all going to come to an end at the first project starts to end at the beginning of next year, and then on for another year. And what I'm doing personally is I just have a so what hat on the whole time. I'm sleepless nights sometimes, but I'm just there thinking we cannot just do more research that is not going to make a difference. So the research project's funny enough, because I am meticulous around every single bit of what we're doing, why we're doing it. Same with the ethics committee. And the research itself is turning into an intervention in people's lives, because we are employing people. People are just the people who are taking part. We've got an ethnography where researchers and people with learning disabilities are hanging out in different people's houses across the UK at the moment. And it's a joy. The researchers are having fun. The people living there are having fun. And also we're finding out more about people's lives. So personally, that's what I'm doing. But in terms of a wider campaign, I'm just there on Twitter the whole time, challenging everything. And there's a lot of people doing that. So hopefully. And just to add, just so that was, I went to a Doughty Street conference. I was asked to give a talk at that about legacy, and I hadn't realised I went last. Thank goodness, so I could change what I was going to say. And certainly in wider terms, legacy changes as 10 years. So I was there being really very angry at the beginning about why isn't things changing? But that's a big tanker to turn around. So I'm just still hopeful that there is change going on.
I have one more question on Slido. Schools are rated by Ofsted. Hospitals are rated by the CQC. Do you think Ofsted and CQC are aware of these issues?
Oh, that's a brilliant question. I don't know much about Ofsted, although that was an Ofsted tweet earlier. That was an Ofsted report shut that school earlier. The CQC, yeah, they're working on our project with us, and they are aware. They're very aware. They have an inspection process that inspects this and completely misses that. They inspect for people being safe. They inspect for people being clean, safe, fed well. They're not inspecting for whether people are having lives that are full of that have opportunity, that have aspiration, that they're able to do the things that they really value. And a recurring theme is people are just taken off to bowling. Everybody goes bowling, and that's a tick for the CQC that stuff's going on. That's an activity. It's a deeply flawed process. I think their intentions are really good. They are trying hard, but we're hoping that one of our projects in particular that we're working with them, we will be able to crank that using a capability approach, a Martin's capability approach, to say you need to think about the opportunities people have, not what they do. And once you twist that lens to look at people's opportunities, you realise in the most comfiest 5-star setting, people's lives are impoverished because they don't have the opportunity to do anything that they want to do. And one final thing on that was that we're running a learning community about it with support workers. One of the support workers, we said, what do you really value? And she said, which is a bit random, she said, it's really important to me to have Britney Spears. And she said, 10 minutes of Britney Spears sets me up every day. She said, I just love it. And it really does get me, it just gets me going. And then by the end of the meeting, when we'd gone through the capability approach and it was about opportunities, she was saying that somebody she supports loves the fresh air on his face, but he has an activity block of stuff in his week, bowling and the rest, which precludes any consideration of him having the air, sitting in the garden with the air on his face, fresh air. And that was a real penny drop moment for her. And I sort of think that was really sort of quite a profound shock that you can be these are really good support workers, really good providers taking part in the project, and yet that guy didn't have his 10 minutes of Britney. So one of our outputs for that project, we think, is going to be a postcard campaign. What's your 10 minutes of Britney? Get you think, what's the thing which is really important to you, which if you didn't do, not necessarily every day, would make your day worse. And once you start to think like that, you sort of think quite differently, really. So that's what we're trying to do.
There's something in the chat. That's brilliant to hear that you've got funding for research. The pandemic has potentially really set things back in terms of the deathly discourse, but also the impact of the closure of services moving online, care homes restricting family visits, etc., all adding risks to the safety and lives of people with learning disabilities.
Completely. We've just submitted a paper around uncertainties in research in times of the pandemic, but also highlighting exactly that the impact is setting us back in a way that we mustn't let it. At the same time, it's introduced new opportunities around people. So many people are online now that weren't before and that sort of thing, but I completely agree, Geraldine.
One last question before we go. One of the things you had mentioned was that a lot of these hospitals and clinics were saying that people with learning disabilities don't know how to communicate how they're feeling or if they feel abused. Do any of your projects have any sort of indicators where people can sort of communicate their sort of quality of life or, communicate, this is how I'm feeling today? And that can be.
Yeah, I mean, that's what I was saying there was that the police don't prosecute. The Crown Prosecution Service will not take these cases forward because the key witness doesn't speak, but they can communicate and they will communicate. People do communicate. You just have to know people really well to understand what they're saying. But in a court, the police, and again, it comes back to value, doesn't it? If you sort of think, well, the person isn't really human, so the fact that they've been woken up repeatedly in the night to have a cold shower, which was this morning's story, I mean, that's not very nice, is it? But they're a different sort of person, so we won't take that forward. And what we need is like the ethics committee changing their criteria and saying, no, you can't exclude people with learning disabilities from research because they've got learning disabilities. We need the courts, we need the CPS to say, we need to prosecute this more because this person was totally defenseless when they were tortured across a long period of time. But I don't think people communicate. They just don't communicate in expected ways.
Absolutely. And also someone wrote, there needs to be more support for family carers to be able to visit relatives in care homes in any future pandemic lockdowns, etc. As family visits help to keep residents safe and help to keep care homes, etc. accountable.
Yeah, totally agree. Again, Geraldine, we're on exactly the same page there. Really. I mean, I think as well, underpaid support workers, disaffected support workers who aren't being encouraged to think in terms of opportunities, who are bored stiff. Once you don't have family carers going in and you're in lockdown, you can almost see how you just start you're so bored that you just sort of switch the telly off if somebody's watching something like you did as kids just to annoy your sister or brother, and how that sort of behaviour, that bored behaviour, can then move into, without any leadership or in that space, how that can become abuse pretty quickly. So I completely agree, Geraldine. Ooh, and no, I don't know about John's campaign rights for residents, but I will Google them after this.
Okay, I don't want to take any more of your time, Sarah, but thank you so much for like I said, an extraordinary presentation and sharing your story. I think it's a lot of food for thought for a lot of us, and will make a lot of people think about things they can do moving forward. So on behalf of everyone, I just want to thank you again. And just a few reminders for everyone. This is the last of our seminar series. And then in July, we'll actually be doing a spoon theory workshop. So people can learn more about people living with disabilities and what it's like to be living with a disability. So stay tuned for that. And also another announcement that this month is actually EDS Awareness Month. And we actually put up some information on the ICH website. So thank you, everyone. Thank you, Sarah.
Thank you. Bye.